Okay, picture this. You're in a critical situation. Your patient can't speak for themselves, and the family is looking right at you, waiting for answers. This is exactly why understanding advanced directives is so incredibly important. So today, we're going to break down how to navigate these documents, from living wills all the way to DNRs, and how to do it effectively in your practice.
So, what is an advanced directive at its core? Well, you can think of it as a patient's voice, projected into the future. This piece of paper is so crucial because it protects their autonomy, and honestly, it brings so much clarity for both the medical team and the family during what is, let's face it, a really stressful and emotional time. So, what exactly do these directives cover? Well, they get very specific. They can outline the exact medical treatments a patient wants, or, just as importantly, what they don't want. We're talking about preferences on things like CPR, ventilation, even feeding tubes, and it can also name the one person, the healthcare proxy, who is trusted to make those tough calls.
All right, now that we know what they are, let's get practical. We're going to look at the different types of directives you're likely to see and, this is key, how to quickly tell if they're legally sound.
Okay, this is a really important distinction you need to understand. A living will is basically the patient's direct voice, but it usually applies to specific end-of-life situations. Now, a medical power of attorney is a bit different. It empowers a specific person to make decisions for the patient anytime they can't, not just at the very end of life.
And then, of course, there's the DNR. It is absolutely vital to remember this isn't just a wish or a preference. A DNR is a medical order. It has to be signed by a physician. And its scope, it's incredibly specific. It applies only to CPR, nothing else.
So, when a family member hands you a directive, here's your quick mental checklist. Is it a written document? Is it signed and dated by the patient? Was it created when they were an adult of sound mind? Was it properly witnessed? And was it made voluntarily? This little checklist helps you rapidly assess its basic integrity right there in the moment.
So, understanding the document is one thing, but knowing when to actually act on it, that's another. So let's talk about your active role as a physician in this whole process.
For a directive to become active, a very specific set of conditions has to be met. It's not automatic. First, the patient has to have lost decision-making capacity. Second, their clinical condition usually needs to be terminal or irreversible. And third, the situation you're facing has to match the conditions described in the document itself.
And this brings us to a really common, and I mean really critical clinical question. What happens when you have a written directive right there in the chart, but the patient is in front of you, conscious and able to speak their mind?
And the answer here is completely unequivocal. A patient with capacity who can communicate their wishes to you right now, in this moment, they always have the final say. Their current expressed decision will always override what is written down in an advanced directive.
So when you do need to implement a directive, you have to follow these steps. First, verify the document. Confirm the patient lacks capacity. Make sure the clinical situation fits the criteria. Then you discuss the plan with the proxy and family, you follow all your institutional policies, and finally, you document every single step with precision. Okay, let's dive into two of the most critical areas for both your clinical success and your legal protection. That's clear communication with everyone involved and absolutely precise documentation.
Let's be absolutely crystal clear about what a DNR order is. It is a medical order signed by the treating physician. It applies only to CPR. It always requires a discussion with the patient or their surrogate, and it has to be clearly visible and easy to find in the patient's medical records.
Now this slide is about busting a common and frankly, a dangerous myth. A DNR order does not mean do not treat. It doesn't mean you stop giving antibiotics or pain relief or basic comfort care. It is only about withholding CPR. That's it.
Look, a directive is completely useless if no one can find it when it's needed most. So, you should advise your patients to store copies in multiple places. Give one to their family or proxy, upload one to their electronic health record if you can, maybe use a digital service, and definitely keep a physical copy at home where it can be easily found in an emergency. When you're speaking with families, the human element is just paramount. You have to explain the prognosis with empathy, be very clear about why the directive is being activated right now, avoid all that technical jargon, and just maintain complete transparency. These are tough conversations for sure, but clarity and compassion are your best tools.
Meticulous documentation is your absolute best professional protection. Your note should include everything: the reason for activating the directive, your clinical assessment of the patient's lack of capacity,
details of all your discussions with the family, any notes from ethics consults, and of course, a copy of the verified directive itself. And finally, let's connect all of these practical steps back to the core ethical principles that really guide our profession and give this work its deeper meaning.
You see, everything we've discussed today is really built on these 4 pillars. Autonomy, that's respecting the patient's right to choose. Dignity, ensuring they receive respectful care. Non-maleficence, which means avoiding undue suffering. And beneficence, prioritizing care that is truly meaningful over interventions that are simply futile.
And that right there is the ultimate goal. These documents aren't about giving up, they're about taking control. They empower patients, allowing them to shape their final phase of life with autonomy and with dignity. Your Mad Lawyer, protecting doctors, empowering patients.